they noticed that after the children were discharged, something happened. 3 to 4 weeks after the fever was over, some children would just die out of the blue, sudden death, or children would get a heart attack. Today, this Kawasaki syndrome is the leading cause of structural heart disease in children in nutrition. Here is a model of the heart I made. I had to use kids' clay, so it comes out looking a little different, but you get the point. This is the heart, okay? What was Kawasaki syndrome doing to the heart? This is the big artery or the aorta that leaves the heart, and these are 3 big vessels from the heart. These, the blue, are veins. Now, around the heart, the aorta, out from the aorta leaves 2 vessels, coronary arteries. What Kawasaki syndrome did, which was more dangerous, was that it did 3 things. The whole heart muscle got inflamed, and so that's why I've used this pink to illustrate it. Heart muscles got inflamed. Secondly, children will develop what is called aneurysms, so that instead of the normal vessel that is nice and smooth, they develop these little bulbs along the vessels that were all inflamed. Remember, I told you inflammation is redness, swelling, pain, and inability to do something. So all these little things are what is called aneurysms. These aneurysms will develop a clot that looks like this, and so the child will get a heart attack and die suddenly. There were many complications, but this coronary artery aneurysms, which I've taken my time to show you with this model, doctors have been researching for years. Everybody knows there's something wrong, but we cannot find a cause. And really, this new syndrome may be the key to catching the thief that comes into the house to cause this syndrome. In this Sentinel paper that the Centers for Disease Control published in the New England Journal of Medicine in 1981, they went out of their way to research 2 outbreaks of Kawasaki disease, 23 children in New York, Rochester, and 57 children in Massachusetts around the Boston area. Influenza, adenovirus, respiratory syncytial virus, coronavirus, OC43229E, herpes simplex, cytomegalovirus, Epstein-Barr, measles, mumps, echovirus 7, 11, 17, 24, 30, Kwasaki viruses, B1, B2, B3, B4, B5, B6, streptococcus, leptospiridae, Coxiella, typhus, spotted fever, chlamydia. They ran it against all these and they ran it against them and their controls, and they still could not find a cause. So up until COVID-19, we didn't know what was causing Kawasaki. 30%, up to 30% of kids who have Kawasaki syndrome will develop this severe heart condition and sometimes die suddenly. Well, guess what? Would come into the hospital very ill, classic Kawasaki disease. They decided to test COVID-19. It was positive. Than 2% of children have COVID-19. In fact, the WHO paid a visit to China and found that only 2% of the cases in China were due to COVID-19. And in fact, 2 studies came out of China. One looked at children, that was about mid-February. They looked at all children that had been infected. At that time, I believe China, and they only found 9 children. They were all not severely ill. So under one, probably no disease. Then another group looked at the Wuhan Children's Hospital and looked at children from 0 to 16. Again, only about 48 cases, all pretty mild. That publication, there have been reports from Italy, France, and United Kingdom and United States with this Kawasaki-like illness. It's not Kawasaki-like illness. It is Kawasaki disease or syndrome. They are testing positive for COVID-19. United Kingdom, they reported an initial 8 cases of children coming in with Kawasaki disease. Initially, they tested negative, but then subsequently, the one who died tested positive in addition to another one. Then the Italian story is the most dramatic. There's a hospital in Italy, in the area hardest hit by COVID-19, which takes care of Kawasaki children. So for 5 years preceding February 17th, 2020, they found out they had only had 9 cases of Kawasaki. Then between February 17th to mid-April, they counted their Kawasaki cases. There were 19, which translates to a 30-fold increase in Kawasaki syndrome. It turned out that all these 19 children were positive for SARS-CoV-2. Same for New York, where as we speak, 102 children have tested positive for COVID-19 and Kawasaki disease. France has also reported 135 cases, with 2 of them with 1 child dead. Same for Michigan, where 3 children are of COVID-19 and also have Kawasaki syndrome. What does this mean? The thief has been caught. For the first time in history, the world is able to syndrome, first observed in 1961, is due to an infection, or at least associated with an infection.